Now let's have a continuation of last class. That here we are going to discuss what is the applications of biomechanics, right? So where we can use this biomechanics as a major application. That for example, if you take, we can have a medical device design, and second we have a orthopedic application, and third we have tissue engineering, and fourth we have cardiovascular biomechanics. So first, if you see the biomedical device designs, here you can design a medical device like prosthetics, implants, and surgical tools. These device is going to help your bone structure. Okay, that is your biomechanics movement. It is going to support in some or other way the movement of your body. So the second one is orthopedic applications, where you can have a for sub class sub application like joint replacement and fracture healing. You like if you want to replace any joint, for example knee replacements, or something, there you want to, when you want to replace one thing with other, you should know what is the actual mechanics involved in that particular one, so that you can easily replace with that the artificial one having the same properties like new one, I mean old one. So here also the biomechanics is very important. And third one is tissue engineering, because if you want to grow the tissue in the place of tissue engineering, like regenerating the tissue, you have to need the better understanding of what is the mechanical properties to have a proper and better growth of tissue. That is the application, one of the application of tissue engineering. And not only this, you have a other sort of application like cardiovascular mechanics, because the cardiovascular is the heart and blood vessel. There is the two combination. So the biomechanics is not only about the skeleton, that is the bones, the muscles, even the muscle movements and the blood flow, everything involves the mechanic properties. Okay, the blood, you can have your fluid properties, and muscles and tissues, so everything have some mechanical properties over there. So we are not confined only to the orthopedics or prosthetics device. We have the option of doing application in many field. One such field here I have like to noticed is that cardiovascular mechanics. Here, with the help of this mechanical principles, you can design heart ball design, because the functionality of heart is opening and closing. So again, that is the movement of wall. That movement, how fast it has to open, how slowly it has to close, how long it has to function like this. Because if you see the normal door, if you keep on open and close the door for prolonged time, automatically the capacity of the door will get reduced. Okay, you may get some noise, or it will not close properly, it will not open properly after some days, after, because of prolonged usage. This is for even simple door, but if you are applying the same concept, opening and closing of the walls in the heart, it should not happen as it should not happen like door, because the wall is something, yeah, it is very important to pump out the blood, because it has to be functionally, it has to function for more than 20 to 25 years, or to the till the last life of the person. Okay, so in such case, if you want to design the heart valve with the same functionality without even 1% of compromise in the sense, then think how we should design the heart valves. Okay, so even simple door, I mean a house door or whatever car door, if you are designing, we have it's the performance is keep on deteriorated over period of time. But the same thing, it should not happen in medical terms, that is medical field, especially if you are making any artificial organs like heart valves design. So here comes again the importance of biomechanics, the understanding of each and every moment, the what are the force and reaction happening, and then yeah, I mean, of motion involved over there. What are the muscles involved over there? What is the elasticity of that particular muscle? How long it can withstand the stress or strain? Everything we have to think, and according to that, we have to design the any sort of artificial organ. not only heart wall, any sort of artificial organ. So, what is the other applications? Not only in I mean medical field, we have other applications of using this biomechanics. That is, one is sports, another one is rehabilitation. How it is used in sports in the sense. In sports, the performance analysis we can do and performance of athletic we can optimized because the way they are jumping, the way they are walking, the way they are running, so everything is matter. That is again the involvement of movement, involvement of motion and action. So how the in what way we can improve their running capacity. So yeah, in what muscles or what the what's I mean how the stamina of that particular person we can be strengthened by changing their pattern of running or walking. So this comes the applications in sports, and that also we can also and we can also prevent the future injury, since we know the injury mechanism or mechanism in the body. If there is any flaw, any mislead of yeah, any movement or misplace of anything, automatically it will end up with what injury, breakage or fracture. So yeah, since we know the deep understanding of that particular injury mechanism, we can easily avoid the risk, especially in the area of sports. And not only this, we have a rehabilitation application. In rehabilitation also, it is one sort of area where you can do effective recovery programs by doing physiotherapy for the patients, and so on. So, and those programs which involved to improvise the endurance capacity of your movement, okay, your stamina of your bone and your stamina of your muscles. If you want to strengthen your muscles to improve their performance, that is the actual recovery program what the rehabilitation is offering. So last one is motion analysis. Again, here comes the analysis of your gait cycle. So to again to overcome, to prevent the future injuries by correcting their gait cycle. So this is the application in sports and rehabilitation. So application in prosthetic and medical device, as I said before, we have so many artificial limbs. You can design, you can made as like a natural movement of your body. Not only this, we can have a surgical tools with the same biomechanical application, and future we can also integrate AA with the help of integration of AA in the same medical device to give even more better performance or personalized medicine and approaches. So this is the 5 minute student activity that we used to do in the class. The title is like where biomechanics around us. That is, the students here they have to find out what are the daily activities they can see involvement of biomechanics, right from walking, sitting on the chair, or lifting their bag, and so on. So they have to find out, and they form a team of two members. They and a final after giving 2 to 3 minutes for preparation. They come to front in the forum. They have to share the biomechanics what they have seen in their daily routine. So this is the assessment related to this topic and the fine mind map of this content, like what we have discussed so far. Thank you.